I'm Dr. Cheryl Gabram at the Winship Cancer Institute of Emory University. I'm a professor of surgery and the director of the Avon Comprehensive Breast Center at Grady. A woman is at high risk for breast cancer if her average risk of being diagnosed with the disease is higher than the population. For example, 1 in 8 women to the age of 85 will be diagnosed with breast cancer, and this gives about an 11% average risk. For a woman who has a 20% or higher greater risk of being diagnosed with the disease, that classifies women at being high risk. Now, there's actually a third category, a very, very high-risk group of patients. And these women can have up to 60 to 80% chance of being diagnosed with breast cancer. These are women who often have the BRCA1 and BRCA2 gene mutation, which requires genetic counseling and testing to determine if they are in this very, very high-risk group. It is important to identify women who are at high risk for breast cancer because we can actually offer them a spectrum of care options, starting from lifestyle modifications to enhanced screening using mammography as well as MRI for screening, to chemoprevention, taking a medication to reduce one's risk for breast cancer, or for those women at very, very high risk for breast and ovarian cancer, those that harbor the BRCA1 or BRCA2 mutation, we can offer them risk reduction surgeries. The risk reduction surgeries include bilateral mastectomies and salpingo-oophorectomies. Salpingo-oophorectomy means to remove the ovaries, and those procedures can reduce a woman's risk for breast and ovarian cancer substantially. It's very important, though, for that very high-risk group who is considering risk reduction surgeries to meet with a genetic counselor to determine their risk status. Many women overestimate their risk, and it's important to understand what a woman's actual risk for breast and ovarian cancer is prior to any treatment strategies. There are a few questions that we can ask a woman to determine if she is at high risk for breast cancer. And they include if you have a personal or family history of breast cancer less than 50 years of age, ovarian cancer, male breast cancer, 2 or more close relatives being defined as a sister, a daughter, a mother, aunt, or grandmother. And remember, both the maternal and the paternal sides of the family count. Or if you've had recurrent breast cancer in the same breast, bilateral breast cancer, and finally there are groups of women at higher risk. Women, Ashkenazi Jewish women, have a 10 times higher risk of having the BRCA1 and BRCA2 mutation, so they may qualify for genetic testing at an even lower threshold. Absolutely, men have to worry about breast cancer as well. It is far less common, though. This year in the United States, about 250,000 women will be diagnosed with both invasive and pre-invasive breast cancer. Only about 1,900 men will be diagnosed, but it still can present as a lump, nipple discharge, or any changes on the breast. So men do have to be concerned about their breast health as well. For men who've been diagnosed with breast cancer, it's important to refer those men to a genetic counselor, since it can often signal that they have inherited the BRCA1 or BRCA2 mutation, which could be carried on to their next generation. So it's very important to identify those men and refer them for genetic counseling or testing. So there are various categories for women at high risk for breast cancer. One is based on family history of breast cancer. If a woman has had a breast biopsy that shows atypical cells, they could also be at high risk for breast cancer. Or if they've had radiation to the chest wall to treat other cancers at a young age, such as lymphoma, they may be at high risk. You may be hearing a lot about BRCA1 and BRCA2 genetic testing, but it's important for a woman to understand her real risk for breast cancer. So talk to your primary care physician or your gynecologist to determine if you're high enough risk to meet with a genetic counselor. At the Winship Cancer Institute of Emory University, in our breast program, we have a high-risk assessment program. If you call 404-778-PINK, will determine if you are at high risk to meet with our multidisciplinary team of genetic counselors and surgical oncologists. Generally, private insurance does cover genetic testing if a woman has significant family history for breast or ovarian cancer, and that includes both on the maternal and the paternal side of the family. Medicare currently only cover genetic testing for a woman who's been diagnosed with breast cancer and has that family history. Currently in the state of Georgia, Medicaid does not cover genetic testing. However, there are grant programs through the Komen Foundation and It's the Journey where women can have access to genetic testing. In September 2010, a paper was published in the Journal of the American Medical Association. This study followed 2,500 women who were diagnosed with a BRCA1 and BRCA2 mutation. And basically, some of them had the risk reduction surgery compared to surveillance. It was the first paper to show that the risk reduction surgeries had a life-extending benefit for these women. So women currently have more choices and can discuss this with their surgeons if they're contemplating such surgeries and if they have been diagnosed with a BRCA1, BRCA2 mutation. There's another group of women who qualify for genetic testing, and those are women who are newly diagnosed with breast cancer, provided they're less than 50, or they have significant family history of breast or ovarian cancer, either on the maternal or the paternal side of the family. And it's important for those women to be tested because it may change their decisions about their surgical part of their care for breast cancer. Please take a moment to understand your risk for breast cancer. Many women overestimate their risk for breast cancer, but yet there's a small number of women who are at very, very high risk who would benefit from some of the options that we discussed today. I'm Dr. Cheryl Gabram from the Winship Cancer Institute of Emory University. Thanks for listening today.